Public Protector Kholeka Gcaleka has firmly refuted claims by the Zimbabwe Human Rights Commission that her office engaged in discussions about Zimbabwean nationals being denied access to healthcare services in South Africa. The dispute arose after ZHRC chairperson Jessie Majome stated on this channel that a meeting had taken place to address that issue, emphasizing the need for lasting solutions to uphold human rights. Well, Advocate Gcaleka joins us now for clarity on this issue. A very good afternoon to you, Madam Public Protector. Thanks very much for your time. Perhaps then we should take us a step or two back as to how this meeting between you and the chairperson of the Human Rights Commission in Zimbabwe came to be and what it discussed.
Good afternoon, Vi, and good afternoon to the viewers for Newzroom Afrika. I firstly want to clarify that there has been no recent meeting with the Human Rights Commission of Zimbabwe. They wrote to us last year, mid-year, requesting to visit our institution in order to do benchmarking and establish best practices, which is a norm. Public Protector South Africa hosts similar institutions, ombudsmen, anti-corruption institutions, Council of Justices across the world for best practices, because of course with the much developed legislation that we have in South Africa around these institutions. So they made a similar request, which we accepted, and they came in September. And during that period, we were also having our strategic planning as an institution, and we found it prudent that it would be quite good for them to also join us for our strategic planning, because they further want to establish their institutions' norms and standards. They met the chairperson and her team met with me, the CEO, the COO, and other executives of Public Protector South Africa. So it was not a one-on-one, it was a team meeting where we took them through the work that we do as Public Protector and so forth. Now, in there, issues arose of similar challenges in countries, service delivery, corruption-related matters affecting good governance and so forth. And amongst those, we discussed the issue of the healthcare systems of both countries. And I even referred her into the report, into the state of the healthcare systems in South Africa, which I did. And I said it would actually be a good report for her and her team to look into and see whether they could do a similar investigation in their country. And I also referred her to other service delivery reports, which we were busy with, which included the report into the state of service delivery into the Eastern Cape. Now, nowhere did it arise that they had a discussion or an agenda point around the access to healthcare system for Zimbabwean nationals. So the reports are untrue. There's never been such a discussion. But moreover, that it has been recently. We've also checked in the office when we got to learn of these news, whether there was any complaint or any further correspondence filed by her or her office, and none of that actually is applicable. So there has never been such a discussion, and she has never contacted my office to discuss this point, which is now a subject matter.
She did indeed say, the meeting discussed benchmarking and other areas of learning, but stated categorically, well, on her account, that she did discuss with you the issue of Zimbabweans and their access to healthcare facilities, which she said was an issue that mattered, or suggested that it mattered to her because it's an issue that was in the media quite a lot. And she went further than that to say she actually found this as to be it was a show of intolerance and xenophobia, and asking that we actually show some compassion and respect an issue or views, presumably, she would have raised with you, but then you say none of that actually took place.
No, she didn't raise those with me. In fact, emphatically, what my team and I committed to her and her team is that we would actually assist them to strengthen their institutions so that they can investigate malfeasance in their own countries and also human rights violations in their own country. So basically, that's what the meeting was about, and to ensure that, firstly, they are correctly legislated in line with the global principles, which we call the Venice Principles, which ensures that institutions such as theirs are able to uphold the rule of law in their country. They are able to enforce human rights and freedom in their country, and they are also able to enforce good governance in their country, because really, that's where it starts. As the public protector in South Africa, my investigations need to focus into our state as a country before I can go outside. We are not opposed to her engaging us as the public protector on the issue. Should she engage us on the issue, we would actually take it from there, but there's been no engagement from her side. I must say, I'm also just taken aback that something that would have taken place in the form of a benchmarking practice almost a year ago, surfaces this year without any communication from her side on this particular issue. If she had communicated and if she intends communicating, we would actually take the matter up from there.
Taken aback, you are. You say, but is it something you're going to take up with her? Because her views were quite strong, and the suggestion that they were said to you and your teams is something I would imagine you would be concerned about, especially if, as you say, they're simply not true.
But it's not true, but also if she is so concerned, she has the powers to investigate. And the investigation starts within the powers of her country. It would be one thing if I listened to the clip, and it would be one thing if she is saying they have conducted an investigation within their country. This is what is happening in their country around issues of human rights, particularly of their citizens accessing healthcare. Their country has probably appealed to our government and so forth. And they then request us to then intervene and assist them on certain areas. Investigation is based on data, and it's based within your area of investigations on what happened, what should have happened, and how do you remedy that particular aspect. So she's not just an ordinary citizen who can just express a concern. She needs to have done work around that. But most importantly, as the Human Rights Commissioner, they are vested with enforcing human rights in their country and by ensuring that their own government observes human rights. But I'm willing to work with her. I work with other public protectors or ombudsmen in other states, and we assist one another. But she knows what she needs to do if she needs assistance from us as the public protector. We had quite a good meeting, and we said that we are open to assisting her institution in any areas in which she would want assistance in. So that avenue is open for her.
Just lastly, are there no sort of standing protocols when it comes to such meetings, in other words, agreements that would ensure that, whatever gets said in public after these meetings, it would indeed be a reflection of what would have been discussed? Because here you are now, to someone or to people who have taken this at face value, you actually agreed with views that have nothing to do with, as you say, reality or, evidence or proof of anything. They're based on views that she holds or she agrees with, wherever those views may have come from.
It's like any other meeting. A meeting has minutes, and it was not a one-on-one meeting. I was there with officials of Public Protector South Africa. It was never an issue on the agenda. It was never on their request for wanting to come to South Africa and actually interact with our institution. So that's basically what the protocols are. It's on the basis of what is the agenda and what has been agreed upon would form part of the agenda. We conducted the business of the day. She joined us for 2 days. And even after that, we actually sent documents to her, which we had agreed on that we would forward those documents. Which were templates around establishing really an institution that's embedded on good governance. So if there was such a discussion, I'm certain that there would have been more information shared post that meeting to take up that discussion, and particularly from her side, if she's the person who would have raised the concern, or at least from my side, I would have requested more information from her side so that we are able to tackle the particular situation. And as I say, it's almost a year and there's never been any other discussion.
Public Protector, thank you very much for your time. Really appreciate it.
Thank you.
Kholeka Gcaleka, the Public Protector, on the back of comments that were made on this channel yesterday by the chairperson of the Human Rights Commission in Zimbabwe, where she said that she had discussed with the Public Protector of South Africa the issue of Zimbabweans being denied access at South African healthcare facilities, condemning this as intolerance and xenophobia, saying South Africans should show more compassion